Welcome back to video number 3 on the ADA 2025 Standards of Care. And these last sections include a number of really nice figures. And I think they really make it easy to understand concepts that I think were historically embedded into text and not as clearly detailed as they are now. I also want to point out that many of these guidelines were done in conjunction with other societies like the American College of Cardiology or the American Association of Nephrology and others to really align what our guidelines are with what others are saying, which makes a lot of sense. So I'm going to go fast, but I actually want to encourage you to look at these sections and really understand what the figures are trying to say. So section 10 is entitled Cardiovascular Disease and Risk Management. The first figure to look at details how to treat hypertension in non-pregnant people with diabetes. The next one is a section that I've never actually seen before, but really love, which is called Screening for Undiagnosed Cardiovascular Disease. And it's very clear and very simple, and I think it's very helpful. Then the next section looks at lipid management for primary prevention of atherosclerotic cardiovascular disease. And then there's a section and a figure on lipid management for secondary prevention. And again, these are clear, they're well thought through, and I think they're very useful to providers who are trying to understand how to best treat their patients. Section 11 goes through chronic kidney disease and risk management. And I think the nicest thing about this, again, is a figure 11.2, which has these wonderful little pictures in terms of the guidelines now, healthy eating, physical activity, use of SGLT2 inhibitors, when to use metformin, RAS inhibitors, statins. It's a very nice way to look at the treatment algorithm for patients who have CKD and how to advance as more advanced treatment is needed. But again, I find it really nice that they've framed it this way. Now, I'm not going to discuss the management of retinopathy, neuropathy, and foot care, but these are all very important aspects of the care of our patients. I'm going to discuss the section on older adults because, again, this has more content in terms of figures and tables. And they talk about the concept of trying to really understand patients as they get older. And there's this 4Ms framework of age-friendly health systems, and it looks at mentation, mobility, medications, and then what matters most. And I spend a lot of time as my patients get older trying to figure out what really is best for them given the context of what they're capable of. There is a figure, and this is actually in an earlier section, but I think of it here, which looks at the health of patients, the age of patients, and what their A1C goals should be. And it's not just a simple figure of where patients should be, but sort of walks them through what they should do based on who they are rather than any given age or any given comorbidity. They then have a section called Simplification of Complex Insulin Therapy, which I like a lot because I spend time trying really hard to figure out how to take my patients who need insulin therapy, particularly if they have type 1 diabetes, throughout their lives, but to how to make it simpler so I don't end up with patients confusing insulin doses or developing hypoglycemia that we're trying so hard to avoid. Now, section 14 is children and adolescents, which is not my particular area of specialty and has some interesting concepts in it, but not that much that appears to me to be new. Section 15 talks about the management of diabetes in pregnancy. And I think that what is most different to me is they basically suggest that it's okay to use CGM values for monitoring patients in terms of their glucose levels throughout pregnancy in conjunction with fingerstick monitoring as necessary. And then they discuss diabetes care in the hospital, but the biggest issue that I think we've come up with lately is whether or not to stop incretin therapies in the perioperative setting, and they give some guidelines in terms of how to help patients prepare for procedures or surgery, which I think is something that we all deal with as we're trying to get our patients safely through any medical procedure. So that's the end of my take on what's new for 2025. This is a living standard of care, so if interesting new updates are available, they will be published throughout the year. And I thank you all for listening, and I hope you all have a happy, healthy new year. Thank you.